A caregiver is someone who generally stays with the patient and takes care of the patient. In an Indian context, typically, it's a family member who's a caregiver. Of course, in the recent times, there is a rising trend to employ people as caregivers for basic remuneration. Ask the treating doctor a few questions. Questions like, what is the type of dementia? What is the severity of the illness? What is the course of the illness? The do's and don'ts as a caregiver. With this knowledge, you can be better prepared. Please understand, you cannot stop crisis happening to one person. But if you are better prepared to handle crisis, you deal with the crisis much better. While one cares for our close relative with dementia, it's important to have a home which is safe, welcoming, and warm. In order to ensure a good, safe place at home, we need to look after some important principles like having the environment clutter-free. Ensure that the floor is not slippery. This prevents them from very dangerous falls. Another important thing is to have a bright lit room. Sunlight brings in warmth, vitamin D, and is extremely refreshing. As a caregiver at home, you could look at many other factors. For example, maintaining a regular timeline or consistency in activities, having a chalkboard or a whiteboard with markers, having timelines about daily activities and schedule could be very useful. Having a large display, wall clock and calendar could be extremely useful. Gently reminding the individual suffering from dementia about the time and date and the place where they are in repeatedly could help them to be more oriented to the people and place around them. It is important for us to remember, along with these changes at home, the most important thing is to be considerate, compassionate, and even though sometimes we do get frustrated, to maintain our calm and cool. Caregivers are typically vigilant 24 hours a day, 7 days a week, 52 weeks in a year. They many times have no rest for themselves. With this, we need to understand caregivers are prone to physical, mental, emotional, social health issues. But it is quite often neglected because a caregiver believes it's the patient who needs more care than themselves. This can lead to a lot of caregiver burden, and each one could be vulnerable to this caregiver burden at different levels. There are two important factors to look for in order to look at caregiver burden. One are the bunch of factors which are involved in the patient, which are called as patient-related factors. The other one are those which are there in the individual, that is the caregiver, the individual characteristics of the caregiver. The characteristics in a patient which can influence the caregiver burden are the severity of dementia. The more severe is the illness, the more could be the caregiver burden. The symptoms of dementia patient, especially aberrant behaviors like hostility, aggression, paranoia, suspiciousness, they could influence the caregiver burden. Psychotic symptoms like delusions, hallucinations could be quite disturbing and lead to caregiver burden. Persistent sleep issues, dependency on daily basis, and advanced stages of illness which require constant monitoring could be some of the important factors which could influence caregiver burden. It is important for us to remember each caregiver is an individual by themselves. Their own experiences, their own stressors, their own challenges of life can influence the perception of caregiver burden. The most important thing could be accepting the diagnosis. Sometimes that could be challenging and people in denial could go through more amount of caregiver burden. On the other hand, people could become extremely anxious about the further course of illness, which can make them worry a lot and not able to focus on the current challenges. Individual characteristics in the caregiver which could further influence are their own mental health status, their own physical health status, and sometimes social issues like where they cannot get adequate social support system from the family, friends, relatives could influence caregiver burden. Financial stress could be one of the challenges which caregivers could be going through. Another important aspect could be their own priorities in life could get haywire with caregiving activities, which could lead them to undue stress. A caregiver has to look at some important aspects. Cloudy days are there to pass by. It's an important saying to remember. When you are a caregiver to someone who's suffering from dementia, it's important to realize it's an illness with a waxing and a waning course. It's a chronic illness, which means there could be extremely bad days, there could be days which are pretty manageable. So it's important for us to realize the bad days most of the times do pass by. So have your patience, be resilient enough to pass through these tough times. It is important to remember charity begins at home. What does that mean? Self-care is something which has to be looked upon. Exercise, hobbies, your own social circle, your own priorities should also be looked upon when you're taking care of someone else with dementia. So do not neglect yourself, because if you do not take care of yourself, you cannot be the best caregiver. It is also important for us to realize, even though we might not want, there might be times when we need to consider daycare facilities, respite care, inpatient facilities. It is important for us to remember one of the most disturbing symptoms is behavioral symptoms. But luckily, most of the times, your neurologist or the psychiatrist should be able to help you to handle these symptoms of aggression, hostility, paranoia through some medications and titration. So do meet your doctor to take some help and help the person ailing with dementia. Remember, a dementia patient is not giving you a hard time. In fact, it is a reflection of the hard time he or she is going through. Be patient, give respect, and you will get along soon.